Have you ever just woken up and felt, wow, different? There's this tiny shift, Something that makes you stop and wonder, what is going on with my body? Well, today, we're going to play detective and decode 3 of the earliest, most subtle signs of pregnancy, the kind that are super easy to miss.
What if those little changes you've been noticing, the ones that seem totally random, aren't random at all? What if they're actually a coordinated message your body is trying to send you? Let's dive in and investigate these clues, one by one, and see what they're really trying to tell us.
All right, so our first clue. This one often just pops up out of absolutely nowhere, and it's probably not the kind of back pain you're thinking of. No, this is something much, much more specific.
I want you to really think about this. It's not that dull ache you get all across your lower back. It's this focused little sensation. It might feel like a gentle pull or maybe even a weird little tingle, but it's concentrated on either the right side or the left. It's the kind of thing where you think, I must have pulled a muscle, but then you realize you haven't actually done anything to cause it.
So, the reason for this feeling is actually pretty amazing. It all comes down to one word: implantation. When that tiny little embryo snuggles into the lining of the uterus has to stretch just a tiny bit to make room. And that gentle expansion can tug on the ligaments and muscles nearby in your lower back, creating that very specific one-sided ache.
And this is where you can really see the difference. Period pain is usually that more intense, front and center cramping that can hang around for days. But this implantation pain, it's typically way milder. It's off to one side, and it's usually gone in a few hours or maybe a day or two. It has a completely different signature.
But of course, it is so important to listen when your body shouts, not just when it whispers. So if that back pain gets severe, if it's making it hard for you to move, or if it shows up with a fever or any dizziness, that's your cue. It's time to call your doctor right away just to make sure nothing more serious is going on.
Okay, let's move on to our second clue. This is something that I think a lot of women are familiar with, but we almost always blame it on something else. We're talking about that sudden, unexpected bloating.
You know the feeling, right? It's that sensation where your abdomen just feels full or heavy, almost like you just ate a giant holiday dinner, but you didn't. It can feel like you've got trapped gas, or just this general puffiness that literally was not there yesterday.
So what's the culprit here? Well, it's a hormone called progesterone. The moment implantation happens, your body starts cranking out progesterone to support the pregnancy. And one of its little side effects is that it relaxes smooth muscle tissue all over your body, and that includes the muscles in your digestive system. This just slows everything down, and that leads to that classic buildup of gas and fluid. Hello, bloat.
And hey, if you're experiencing this, you are in very good company. This early bloating, it affects about a half of all women in early pregnancy. So yeah, it is an incredibly common hormonal response.
And I really want to make this clear. This bloating has absolutely nothing to do with the actual size of the baby. At this point, the embryo is unbelievably tiny. We're talking about the size of a single grain of rice. The changes that you're feeling are 100% driven by that powerful hormonal shift that's just getting started.
Okay, let's get to our third and final clue. Now, this one can be the most alarming or confusing because it's so easily mistaken for the start of your period, but it is fundamentally different.
We are not talking about red flowing blood here. This is what's called implantation spotting. It usually just looks like light or even dark brown spots in your underwear. In fact, it's so light sometimes that people have described it as just looking like a little bit of dirt. It's really, really minimal.
And the reason for this is actually pretty simple and kind of cool. As that little embryo burrows into the super blood-rich lining of the uterus, it can sometimes disturb a few tiny blood vessels. This just causes a very, very small amount of bleeding. And by the time that blood makes its way out, it's old, it's oxidized, and that's what turns it from red to brown.
So this clue isn't quite as common as the bloating we just talked about, but it's still a really significant sign. It happens in about 20 to 30% of early pregnancies, which makes it a pretty well-known indicator that, yep, implantation has successfully happened.
So let's put these side by side again, because this is where everything becomes so much clearer. A period? That's a heavier flow of bright red blood that lasts for several days. Implantation spotting is exactly what it sounds like. It's just spotting, it's brown, maybe a little pinkish, super light, and it's usually completely gone in a day or two.
Okay, so we have our 3 clues. A one-sided backache, that weird unexpected bloating, and some light brown spotting. Now, taken individually, they could mean, a million different things. But when they all show up together,
That's when the story really starts to get interesting.
Let's just walk through this one more time. They all appear together because they are all triggered by the exact same biological event. The physical act of implantation is what directly causes that uterine stretching for the back pain and that minor bleeding for the spotting. And at the very same time, that implantation signals the body to kickstart the hormones that cause the bloating.
And this is the crucial point. This is the whole shebang right here. It is not a coincidence. These three symptoms that seem so random and unrelated, they are all just dominoes being knocked over by the very same first push. So the convergence of this specific trio, that ache, the bloat, and the spotting, it's one of the strongest yet most subtle hints your body can give you that a new journey has begun.
So if you're feeling these signals, it really leaves you with a pretty powerful question, doesn't it? It's like this quiet little whisper from your body, asking you to just pay attention. Because what you're feeling right now, it might just be the very first chapter of a whole new story.